Am I ready to start my own private practice? Or am I crazy for even thinking about it? That's one of the most common questions that physicians ask me. Hi, I'm Dr. Brittney Anderson. I am a board certified family medicine physician and private practice owner. I started my own clinic in 2022 from scratch, and now I help other physicians who are thinking about doing the same thing. If you've ever wondered whether you're truly ready to start a private practice, this video will help you think through that. In this video, I'm going to share with you 3 signs that you may actually be ready to start your own private practice. The first sign is this: you're frustrated with the system, but you also have ideas for something better. A lot of physicians are unhappy in employed practice, but frustration alone doesn't mean that you're ready for private practice. The physicians who tend to succeed in private practice are the ones who start thinking things like, what if I did visits differently? What if I structured my schedule this way? What if I built a clinic around the care that I actually want to practice? When you move from complaining about the system to designing something better, that's a big sign that you may be ready for private practice. The second sign that you may be ready for private practice is that you're willing to learn business. Now, don't get me wrong, you do not need an MBA to start a private practice, but you do need a willingness to learn. Private practice means understanding things like revenue and expenses, marketing, patient acquisition, and systems. You don't have to know everything on day one, but you do need to be curious enough to learn how your practice will actually work as a business. The third sign that you may be ready to start a private practice is this: you want ownership, not just control, but true ownership. Now, many physicians say they want autonomy, but what they really want is less responsibility. But private practice is different. You are the owner. You get to design the schedule, the culture, the services you offer, and the experience that patients have in your practice. But it also means that the decisions are yours. If that idea excites you more than it scares you, that's another sign that you may be ready for private practice. Here's something important to remember. You don't have to feel 100% ready to start a private practice. Most physicians don't. What matters is that you have the vision and the willingness to build it step by step. Starting a private practice is one of the most challenging and rewarding things that you can do as a physician. And for many doctors, it's the path back to practicing medicine the way we always imagined it. But the real question isn't just, can I start a private practice? It's, is private practice the right move for me right now? If you're asking yourself that very question, don't worry, I've got you. I created a short quiz called Is Private Practice Right for Me Right Now? It walks you through a few key questions that help you think through whether this path actually makes sense for you at this stage of your career. You can take the quiz using the link in the descriptions below.